I'm Cathy Herceg, and I am primary therapist and group facilitator and somatic therapist here at Get Well Behavioral Health. So at Get Well, one of the things that we do is we work with the worried well population. And so a lot of times you have daily stressors. We don't consider them like, single incident traumas like a car accident or whatnot, but there are ongoing stressors in life. Raising children, being married, having a stressful job, and this all accumulates in the body, and then our pre-programmed responses to trauma end up getting ignited, and there's nowhere for them to go. And so by using somatic therapy, we're able to ground and resource the client, widen their window of tolerance, and allow them to not feel like they're drowning during these daily stressors and pressures that will continue to occur in a person's life. One of the things that I like to say is we're not doing massage here. We're not actually touching the person's body. That is not what somatic therapy is. Somatic therapy is just becoming aware in slow increments. Most people, I start with breathing, and it's not even breathing exercises. Just notice if you're breathing is one of the first ones, because a lot of people live in their head and they don't even notice their body. So by becoming embodied, it's a process by noticing positive emotions in the body. So that's a place that we actually want to go to and not constantly retreat from. And then once we create that, then we will have the space to be able to go into the body and process those traumas. Again, only at the outer edges, not having to go to the root of the trauma to process it to completion. So that is done in session by, thinking of things that make you happy. There's someone likes tennis, that can be a grounding and resourcing, or cooking, sight, sound, smell, touch, taste. And then once we ground and resource, then we're able to go to the traumas because we have an anchor, something solid in which to hold on to process the traumas. And it's not a bunch of crying, or you can cry, but notice a lot of times it might just be some shaking or trembling, like Dr. Peter Levine, somatic experiencing, talks about. Or it could just be a slow jerk, or it could be heat rising from your body, or maybe a burp a lot of times. I've seen that a lot in sessions. So there's no physical touching going on. It's just basically a lot of dialogue and widening the window of tolerance.